Hello dears, welcome back to a new video. In today's video, we are going to see the continuation of your drugs used in CHF. Last lecture, we had discussed about the beta adrenergic agonist. In today's video, we are going to discuss about the third classification of your positive inotropic drugs, that is PDE3 inhibitors. This PDE3 inhibitors will called as positive inotropes. Okay, and we have the examples here, Amrinone and Milrinone. Okay, this is used in the severe acute heart failure cases. These drugs are called ionodilators because they do two actions. First one is the ionotropic action, that means it will increases the contractility, and comes to the second effect or action, that is vasodilator activity. That means it will decreases the vascular resistance. So they improve the heart failure by increasing the cardiac output as well as reducing the preload as well as afterload. And comes to the important portion, that is the mechanism of action. What does this CMP do in the heart? Though the CMB will increases the calcium entry, we know if the more calcium is present inside your cell, we can tell stronger contraction we will get, right? So comes to the Amrinone or Milrinone inhibit the PDE3 inhibitors. What? These two drugs will inhibit the PDE3 inhibitors. So thereby the CAMP increases inside your cardiac cells. So once the CAMP increases, we know the calcium ions enters the myocardial cells. It will be more. So we will get the stronger contraction, thereby we will called as positive inotropic. And the same time it relaxes the blood vessels. That's the word second activity, that is vasodilation. This is the mechanism of action of your Amrinone as well as Milrinone. Okay, what first, it will inhibit the PDE3 receptor. When we are inhibiting that, your CAMP will increases inside the cardiac cells, thereby more calcium enters into the myocardial cells. If the calcium amount is more inside the cell, we will get the stronger contraction. That's what we are calling as a positive inotropy. And the same case here, which will relaxes the blood vessel, so we'll call it as vasodilation. Next comes to the effects. What effects it will give? In the case of heart action, it will increases the contractility as well as cardiac output. Second case is blood vessel action, that is vasodilation, and it will decreases the preload as well as it will decreases the afterload. So workload on heart will reduces. And comes to the uses part. These are not routine CHF drugs, used only in severe refractory CHF as well as acute decompensated heart failure as well as short-term IV support in ICU. Okay. Next comes to the adverse effects. Ventricular arrhythmias, hypotension, headache and gastrointestinal upset are the adverse effects of your drug. And the special case or special point which you have to remember is Amrinone, which will causes thrombocytopenia. Thrombocytopenia means decreases the platelets amount. So nowadays the Milrinone is preferred. Okay, so I hope you people understood. In this case, the mechanism of action is very important. That is, CAMP will increases. If the CAMP increases, gradually your calcium ions also will increases inside the cell, thereby increases the contrastility. So here is the end of your classification of positive inotropic drugs. So in the next lecture we will see about diuretics. So hope you understood. If anything is there, any doubts if you have, please comment on the comment section. So thank you for watching. Bye bye.